COVID-19 tests will appear soon in mailboxes throughout the country. And here with some advice about using them is Dr. Helen Boucher, the Dean of Tufts Medical School and an infectious disease specialist at Tufts Medical Center. Thanks for joining us, Dr. Boucher.
Nice to see you, Erica.
All right, Dr. Boucher, it's been a while. I think about 6 months or so since Americans could order free tests from the government. So why do you think health officials are offering them now? I had heard that perhaps we are past the peak of RSV and flu, but is COVID obviously still rising?
Well, it is in some places, Ben, and it's also winter, right? People are coming indoors to dry places where the viruses transmit more easily. It's also holiday time, so there's travel and indoor gatherings, and testing is a great way to lower risk and to help folks make decisions about the risks they want to take, especially if they're going to be around those vulnerable relatives and friends.
My understanding is we have new COVID strains that are circulating, apparently BQ1, BQ1.1, those the most prevalent in New England. So can the current test still detect those subvariants?
Yeah, great question. So those subvariants make up about 2/3 of the strains that are circulating today. And the good news is that tests detect them just fine.
Well, as you know, Dr. Boucher, a lot of folks are walking around with coughs, congestion. Some of that might be from COVID, but others might have the flu, RSV, or simply a common cold. The symptoms for all of those things are pretty similar. So is testing the only way to tell them apart, even for doctors? And we've all heard stories of someone who might on the surface appear to have COVID, but yet never tests positive on one of those take-home tests.
Yeah, so a lot of things packed in here. Yes, the only way to know if it's flu, COVID, or RSV is by testing. And it's important to test, especially if you're concerned about COVID or flu and you might need treatment. So if you're at risk, those would be reasons to talk to your doctor. It's even more important to stay home if you're sick and to remember that we still have very effective vaccines for both COVID and influenza, and many people, including people at risk, who haven't taken advantage of those vaccines.
And treatments too we have now, of course. So for people who test positive, and you've said before, Paxlovid, it's effective for certain patients, but do they need to have serious symptoms before they can even get it?
Well, actually, the indications for Paxlovid are for mild to moderate COVID in people who are at risk of getting complications. And that includes many, many adults, the people who are overweight, have lung disease, heart disease, and especially older adults. So if you have COVID and even mild symptoms, it's reasonable to speak to your doctor and see if you qualify for Paxlovid.
All right, Dr. Helen Boucher with Tufts Medical Center. Dr. Boucher, happy holidays. Thanks for your time.
Happy holidays.